Hi everyone, I'm Dr. Tim Osborn, Cranio-Maxillofacial surgeon, and today we're going to talk a little bit about rhinoplasty. It's a way that we would surgically reshape the nose. One of the most important points when you're thinking about a nose is that form equals function. So when a nose looks really good, it often functions very, very well. One of the things that we do from very early on is we assess how is the form of your nose relative to the function of your nose. So if you're having issues with breathing, is it coming from your septum? If your nose feels too big, is it something that's from an overgrowth that is leading to a lack or improvement of function? So the most critical point that any rhinoplasty surgeon has to go through is figuring out what it is that we're actually treating. And so if we make it look better, we also have to figure out a way to make it function better. Once we assess the shape of your nose, how the shape is relative to the function, how well you breathe, we'll look on the inside part of the nose. So a big part of what we do is we assess the history, is ask you when you're doing vigorous activity, how well is your breathing? If you get a cold, can you breathe at all? Things that just help us gauge how well you're actually breathing. When we look on the inside, the main thing that we look at is your nasal septum. The nasal septum is the piece of cartilage that lives in the middle part of your nose. It's kind of like the tent pole, the center tent pole. It's also the most significant thing that leads to growth issues. So sometimes it grows too far in one direction, not enough in another direction. Most commonly, it's going to be somebody has a hump or a bump in their nose looks too big, or their nose looks too small. So we're going to help you figure that out from the inside out. We'll explain to you how the form of your nose relates to the function of your nose. One of the critical things to understand with rhinoplasty is balance and proportion. My training is in not only open rhinoplasty, but also with closed rhinoplasty, which is relatively unique. Some people get a little bit of exposure to one, have a huge amount of training in another. I've evolved my technique over time, so I've gone from open to now doing it almost exclusively closed. And the reason for that is I found people just do better with closed rhinoplasty. It's less surgery, it's less recovery, and on my side of it, I get to see exactly what's happening during surgery. So I always take a photo of my patients as we finish their surgery, and I can pretty reasonably predict that if everything goes how it's supposed to, that's what it's going to look like after a couple of months.